Hey guys, this is Dr. Kanan Jhaveri, consultant OBGYN, obstetrician and gynecologist, and a mother to two kids. Welcome back to my channel, and today I'll be talking about a very important topic, that is HPV vaccine, everything you need to know. But before I start with anything, let me share with you some statistics related to cervical cancer, that is as per the survey taken in 2022. So, according to this survey, globally in the year 2022, the cases of cervical cancer were 6,62,301, out of which India had 1,27,506 cases. Now, if we look at the deaths that happened because of cervical cancer, then this number globally was 3,48,709. Whereas in India, the deaths because of cervical cancer were 79,906. Now, looking at these numbers, no need to say that we need to know everything about anything that helps us prevent or fight against this cervical cancer. So, guys, what is HPV? HPV means human papilloma virus. Now, this virus is very contagious and it gets transmitted through sex. Now, the infection usually occurs after the first sexual activity. So, most of the infections are asymptomatic and transient, but sometimes persistent infections with highly oncogenic types of HPV, that is the types of HPV that cause cancer, can lead to the development of cervical cancer, and not only cervical but also anal cancer, penile cancer, vulvar cancer, vaginal cancer, as well as cancer of the back of throat, that is the oropharyngeal cancer. So let's understand how does this HPV vaccine work. Now, HPV vaccine has been developed against some of the very common types of HPV viruses that lead to cancer. So there are basically three types of vaccines available: bivalent, quadrivalent and nonavalent. Now, these vaccines are prophylactic, which means that they prevent the infection to happen, but once the infection has occurred, they have no role in curing that infection or reducing the time of clearance of that infection, right? So it is very important that you get vaccinated before your first sexual activity. So the recommended age by CDC for immunization is 11 to 13 years. However, you can take the vaccine as early as 9 years. And if you haven't taken between 11 to 13 years of age, then everyone below 26 years of age have to be immunized. So these are the guidelines. For people between the age of 26 to 45 years, the decision has to be individualized whether the vaccine has to be taken or not. So everyone who is in the high risk group, that is, they have the possibility of getting in touch with a new HPV virus. For example, possibility of a new sex partner, or homosexual people, or transgender people, or even people with low immunity, they should be taking the vaccine. Now, how does this vaccine need to be taken? How many doses? So, if you are below 15 years of age, then you need to take 2 doses, 6 to 12 months apart. And if you are above 15 years of age, then you have to take 3 doses at 0 months, 2 months and 6 months respectively. Now, having said all this, let me answer some frequently asked questions. So, when can you not take this vaccine? This vaccine cannot be taken when you are pregnant. However, you can take it during breastfeeding. And also, if you are having hypersensitivity to yeast, then this vaccine should not be taken. If you are suffering from some acute severe illness, you should avoid taking this vaccine until it is cured. Question number 2. So, can boys take this vaccine too? Yes, definitely. As we had seen earlier, that HPV causes not only cervical cancer but also anal cancer, penile cancer and oropharyngeal cancer. So definitely it is recommended that boys take this vaccine too. Question number 3. What are the side effects of this vaccine? So, extensive research has been done regarding the safety profile of this vaccine, and it is really safe. So the only common side effects that occur are a little bit of redness or tenderness, pain, swelling at the site of injection, which commonly happens with all types of injections. And the more serious side effects that you can say are dizziness, giddiness, a little bit of headache or a little bit of fever, but these are not very common, and even if they do occur, they are very transient and they just go away on their own. Right, so the vaccine is really safe. And question number 4, what is the effectiveness of this vaccine? So as per the studies, this vaccine is 99% effective, which means it is really good, and it is recommended by CDC, that is the Center for Disease Control and Prevention globally. So having said this, I request everyone who is watching this video to share this knowledge with your friends and family and be a part of creating the awareness campaign regarding cervical cancer. Thank you very much. For more updates and facts, stay connected to my channel, subscribe if you haven't done it yet, and if you have any questions or queries, post them in the comment section below and I'll try to answer them all. Thank you so much and bye.